Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. Today presentation will continue history taking station. Our symptom today is cough. For definitions, acute cough is less than 3 weeks and chronic cough is more than 8 weeks for duration. There is many causes for cough, starting with acute infections like common cold, pharyngitis, bronchitis, pneumonia, whooping cough, also tuberculosis, fungal infections, and HIV. Also, chronic causes like bronchiectasis and lung abscesses, asthma, COPD, upper airway cough syndrome, previously known as post-nasal drip syndrome, due to allergic rhinitis or sinusitis, irritation of bronchial tree by smoke, fumes, house cleaners, or dust, inhaled foreign body or aspiration. Other causes like Brinkman lung disease, pneumonitis might be caused by drugs like amiodarone, might be hypersensitivity pneumonitis due to birds or farmers' lung cancer, bronchogenic carcinoma, sarcoidosis, pulmonary embolism, heart failure, medications, and most common medications like ACE inhibitors and beta blockers, idiopathic or psychological cough. As a differential diagnosis for pneumonia, cough will be associated with fever, dyspnea, rigors, and night sweats. Asthma, it will be episodic cough, episodic wheezes, dyspnea, dry or productive cough worst at night. In COPD, it will be persistent cough, large amount of sputum, and shortness of breath. For bronchogenic carcinoma, most important, it's new cough or a change in cough character or frequency, dyspnea, hemoptysis, weight loss, and anorexia and chest pain. In heart failure, there is exertional dyspnea, cough and fatigue, and orthopnea, paroxysmal nocturnal dyspnea, and edema, all cardiac symptoms. Sarcoidosis cough will be associated with shortness of breath, erythema nodosum in the skin, eye inflammation, fever, and fatigue. To start our station for history taking, as usual, we'll start as set, dialogue, and closure. In the set, as usual, also we'll start with greeting and introduce yourself. Hi, I am Dr. Hadidi, SHO of Internal Medicine. Then confirm patient details. So you are Mr. Muhammad, and are you or you are 55 years old? Then build good rapport. Please have a seat. May I sit beside you? Then explain note taking. If you don't mind, I would like to take some notes for the purpose of interview, which will be strictly confidential. Is it okay with you? Then agree the agenda. I have received a letter from your GP stating that you have cough. Is it right? After the introduction, the dialogue, we will start with the present history and presenting complaint. Can you tell me more about your cough? Do you have dry cough or what is the character of your cough? Is the cough dry or with phlegm? What is the color of the phlegm? Either yellow-green, it's purulent, or clear phlegm. How much phlegm do you produce per day? And we try to know the amount of sputum, either by spoons or cups. Do you cough up a large amount of purulent phlegm or phlegm with foul odor or foul smell? This usually with bronchiectasis or lung abscess. Then go for history of presenting complaint, the numeric Odbara. Start with O, onset. How did it start? Did it start suddenly or gradually? Then D, duration. For how long do you have this cough? Then P, progression. Is the cough worsening over time, like in asthma, heart failure, or cancer? Is the cough persistent all the time or intermittent? When does the cough worse? At night or morning? Is there any change in frequency of cough over time? As we said, changing frequency might be a sign for in a patient with COPD for developing cancer or bronchogenic carcinoma. Then complete the Odbra, aggravating factors. Ask about aggravating factors. Has your cough started after a recent cold or flu, like in post-viral asthma? Does your cough worsen during or after exercising, like asthma or allergic rhinitis? Does your cough worsen when exposed to cold weather? like in asthma or upper airway cough syndrome? Does your cough worsen at night in asthma or GERD or congestive heart failure? Does your cough worsen with the changes of position, like in bronchiectasis? Does your cough worsen by mold, dust, or smoke in asthma? Does your cough worsen during a particular season, like asthma also? Have you started any new medication? It's very important, ACE inhibitors and beta blockers. Complete the Adbara regressive factor. Like, does your cough improve with over-the-counter antihistamines, like in allergic rhinitis or upper airway cough syndrome? Does your cough improve while you are sleeping, like in psychogenic? And at the end, for associated symptoms, which is very important, do you have fever? Have you noticed coughing up of blood, and how much? Do you have chest pain? And if there is chest pain, don't forget to analyze the chest pain itself, like in bronchitis or bronchogenic carcinoma. Do you get short of breath with exertion, like asthma or COPD or heart failure or pneumonitis? And if there is shortness of breath with exertion, how far can you walk before your breathing stops you? How many flights of stairs can you manage without stopping? To complete the associated symptoms, is your cough associated with wheezing? And do you have associated hoarseness of voice, like in GERD, laryngitis, or upper airway cough syndrome? Do you feel frequent burning or sour taste in your mouth, like in GERD? Do you feel itchy nose or frequent sneezing or itchy throat or desire to clear your throat, like in allergic rhinitis? Do you sleep with more than one pillow, like in orthopnea, or do you wake up shocking or short of breath, paroxysmal nocturnal dyspnea, like in congestive heart failure? Do you have night sweats, weight loss, and poor appetite, which is common malignancy or TB? So this is a present history. After that, we'll start the past history. Have you ever been diagnosed with any medical condition? Have you had any similar condition before? Have you ever been admitted to hospital for similar conditions for chronic cough causes? Have you ever had any surgeries like lobectomy or minor operations or procedures like bronchoscopy or mediastinoscopy? Have you ever been diagnosed with asthma or other lung disease like COPD or interstitial lung disease? Have you ever been diagnosed with cancer? Have you had TB in the past or tuberculosis in the past? Have you been exposed to patients with active TB? Do you have any heart disease or high blood pressure? For medications and allergy, do you take any medications? What medications are you taking? Any over-the-counter, any herbal remedies? Are you currently using inhalers? And if so, what type of inhaler do you use? How do you use it? Are you currently taking any drugs like ACE inhibitors, beta blockers, hydralazine, non-steroidal anti-inflammatory drugs, bioglitazone, or amiodarone? Did you receive vaccine for a disease called tuberculosis? Very important to ask about history for BCG vaccine. And then don't forget to ask about allergies. Do you have any sort of allergies? Have you ever been diagnosed with allergy? Then go to family history. Any similar conditions in your family? Are there any illnesses or diseases that run in your family? And ask specifically about, does anyone in your family have asthma, rhinitis, or allergy? Also ask about cancer. Does anyone in your family have cancer? Does anyone in your family have tuberculosis? Very important. After family history, we'll go to social history. Don't forget to ask about occupation. Very important, exposure to certain materials like asbestos, chemicals, or pollution. What do you do for living? What kind of work do you do? How long have you done this work? Any previous jobs? What other jobs have you had before? Have you ever been exposed to asbestos, chemicals, or pollutions at work? Ask about smoking habit. Do you smoke? And if he is smoking, how much do you smoke and for how long? And what do you smoke exactly? Is it pipe, cigar, cigarettes, or vape? Ask also about illicit drugs. Do you use any drugs that alleviate the mood? Any injection drugs? Do you have ever shared needles for risk of HIV? Also ask about household allergens. How are things at home? Have you been exposed to mold, house dust, mites at home? Ask about history of travel to endemic areas like India, endemic areas for TB. Have you recently traveled to countries where TB is endemic? Pets or birds? Do you have any pets at home like cat, dog, or bird? Then, before ending of the dialogue, ask about ideas, concerns, and expectation. What do you think might be causing this problem? Are you worried about this being anything in particular? What do you think might be the best plan of action? At the closure, summarize the main points. May I take a moment to summarize what you have told me so I can check that I have understood everything that's important to you? Ask about any outstanding issues. Is there anything else we haven't discussed that you feel is important? Create a list of problems. So I think you have problem of your lung called bronchiectasis, which makes your lung susceptible to recurrent infections, which causes a profuse amount of phlegm. Plan the next few steps. I will examine you first. We may need to do some tests in the form of blood test, and we may need to do some imaging or X-ray. This can be done in outpatient basis. Then I will decide whether to admit you or not. Also, counsel on health promotion, which is very important here. There are some advice I need to tell you about. Smoking is not good for your health, and I am going to arrange another meeting to help you to quit if you wish. Check understanding. Is there anything unclear you need me to clarify? At the end, thanks the patient. Thank you, Mr. Muhammad. Thank you. And these are presentations from free medical courses on our YouTube channel. Thank you so much.